Thank you so much. You know, as a medical oncologist, I actually have a great job. I get to know and I get to care for people like Kelly, Felicia, Georgia Weedy. It's really a privilege to take care of them. As Chief Medical Officer, I also have the honor of hanging out with folks like y'all. Frequently, people ask me, how are we doing in the war on cancer? How are we doing in the fight? And I also have the opportunity to have with me all the numbers. I'll tell you right now, we've done well. We can do better. We must do better. So over the next 5 or 6 minutes, why don't you guys for a second try to be a nerd like me? You don't have to wear short pants with black socks and wingtips, but try to be a nerd for a second and be an epidemiologist and a cancer biologist, and let's look at a few things about cancer and let's learn what are we doing right now. First, what is cancer? Cancer involves, that was interesting. Let's go to the next slide. Cancer involves mitosis. Remember high school biology, cells doubling, 1 cell becoming 2, 2 becoming 4, 4 becoming 8, 16, 32, that's about as far as I can go. Cancer is uncontrolled cell growth. Normal mitosis is controlled cell growth. This is a beautiful picture. This is a cell undergoing mitosis, prophase, metaphase, anaphase, and telophase. You'll remember this from high school biology. This is controlled cell growth. Cancer is uncontrolled cell growth. It is uncontrolled mitosis. When we biopsy someone's cancer, it looks like this under the microscope. That's what a pathologist sees to say that this is an adenocarcinoma, the type of cancer we frequently find in the lung, prostate, or breast. Hopefully it's localized. We frequently can cure it when it's localized. When it is metastatic, as you see here, you can see the skeleton here. All the dark spots there are spread of cancer to this woman's skeleton. That's metastatic cancer. That's what kills. That's the kind of thing that we have trouble controlling today. Now, as I said, we have done well, we can do better, and we must do better. Just a few numbers. Now try to pretend you're an epidemiologist for a second. In 1900, for every 100,000 Americans, 64 died from cancer that year. In 1991, for every 100,000 Americans, 215 died from cancer. In 2010, 170 died from cancer for every 100,000. That is our 22% decline in mortality or 22% decline in risk of death. That is a really good thing. That means that less people are dying. As we look at various diseases, let's look at lung cancer. Lung cancer, we've had about a 22-23% decline. It's very much because of prevention. It's because many people don't realize in 1955, 55% of men smoked cigarettes in the United States. In 1965, 35% of women smoked. And we've gotten those numbers down dramatically, and we're preventing people from developing lung cancer. But we can do more. 22% of men still smoke. 16.5% of women still smoke. Among people who are impoverished, it's almost 30% who smoke. For breast cancer, we've had a 35% decline in breast cancer mortality since the late 1980s. This line going down as you go from 1975 through 2010, that's a decline in mortality. That's a good thing. A woman who's age 50 today, her risk of dying from breast cancer is about 2/3 the risk of a woman age 50 in the late 1980s. It's a good thing. But we can do better. We must do better. There's still 40,000 women dying from breast cancer every year. We've had improvements in treatment that caused that decline. We need better improvements in treatment. Awareness has caused that decline. And screening, by the way, in that order. Treatment being more important than awareness, being more important than screening. For colon cancer, for men in blue, women in red, we've had a 35 to 40% decline in risk of death. Very much like with breast cancer, this is good, this is important. We've got to do better, however. And it's because of improvements in treatment, screening, as well as awareness. Indeed, in colorectal cancer, we could save 15 to 20,000 more people per year if we just got all people over 50 instead of half to get regular screening. Now, the future of cancer is cancer prevention. Oh, go back one, please. I'm sorry. I hit the thing wrong. These are the causes of cancer. You can see smoking at the bottom causing a third of all cancers, but obesity, poor nutrition, and physical inactivity is a big cause of cancer. Next slide. You can see this is especially an American problem. And this is the time when Jeff Ross says they sent a fat guy to talk to you guys about obesity and cancer. It's true. We need to focus on diet and physical activity to lower our risk of cancer. By the way, the problem with obesity, high caloric intake, and lack of physical activity is causing a tsunami of chronic disease in the United States. Diabetes, cardiovascular disease, orthopedic disease, as well as cancer. Many people are not aware that it causes 12 different cancers. Many people are not aware that over the next 10 to 20 years, it's likely to surpass tobacco as the leading cause of cancer. We can save more lives. We need to support research. We need to respect its findings. When I say respect its findings, we need to be conservative and orthodox in our interpretation of those findings. We can save more lives. We can do better. We must do better. We're all advocates for cancer research and cancer control. That's why we came here. We actually need to sort of transform healthcare, and we need to become instruments of cancer control. We need to become delegates to go out and teach people what they need to do to control cancer. We need to work on it hard ourselves sometimes. We need to go out and spread the word. I'm going to leave you by saying we have done well, we can do better, and we must do better. We need to support research, and we need to get out there and spread the word. Thank you so much.